Welcome, everybody. This is now our second day of the National Academy of Sciences, Engineering, and Medicine's forum on the systematizing the One Health approach and preparedness and response efforts for infectious disease outbreaks. And we're very happy to welcome you to, again, the second day of the workshop. So I'm going to give a brief recount of what happened yesterday and then introduce today's activities. And I think that originally we were thinking of the first day as more of a past, and then the second day as a present, and the third as a future. But in fact, because of One Health being so central to COVID-19 pandemic, which has pretty much taken over all of our lives, I think that yesterday we actually had some really interesting insights into what's going on presently as well. And so, and today what we're going to do really is think about how to systematize the education and the workforce for One Health to prepare for both the present and the future. So yesterday we had a really wonderful keynote address by Eric Goodby, and give a very nice overview of the challenges really at all levels of incorporating a One Health approach at local, regional, national, and global levels, but also how critical that is. Also highlighting some of the inequities that we've seen during the current COVID-19 response. And also the really gave a very nice overview of what One Health requires in terms of a multi-sectoral, transdisciplinary, collaborative, transparent approach, as well as it really brings in accountability for all the different sectors and a shared responsibility. So I think that shared responsibility and leadership and accountability is a critical point to keep in mind. He also really emphasized the idea of a local to global, but then also global to local. So coming back in full circle to how important it is to have capacity on site everywhere to be able to respond, to detect, and to respond and to prevent. He also talked about the importance of a universal health coverage and being able to have not siloed medical aspects, but rather a more complete, holistic approach where everybody is covered, and also all diseases are seen at the same time. And really importantly, that acting alone is just not possible. That reaching out is good, and it's important to have essentially a safe space to be able to sound the alarm when something is wrong internationally. Now, we then had a couple of really excellent case studies and heard from Dana Wiltz Beckham, who gave a really excellent summary of operationalizing One Health at a local level in Harris County, Texas, with a lot of examples of how they've really been able to take that approach both structurally as well as in certain infectious disease outbreaks along the way. And then we heard from Supaporn, who's deputy chief of the Red Cross Emerging Infectious Diseases Health Science Center in Thailand. And she also was able to show how Thailand had a very early response, actually detecting and sequencing the SARS-CoV-2 even before it was released. The sequence was released from China. And so they actually had a first case on January 9th. And then by January 11th, we were able to match the sequence once it was released, and then immediately bring in a public health effective approach, which then went further to look at the sources of potential other coronaviruses in bats and beyond, but all at a local level. And then we also had a really nice summary from Thierry Nyatanya, who talked about the COVID-19 response in Rwanda. And it's interesting because Rwanda has actually embraced a One Health approach at the national level for many years. And so this was able to be seen how the multi-sectoral approach was used for the current COVID-19 pandemic, combining many different ministries together and really emphasizing local solutions and local innovation at multiple levels and examples. So today what we're going to do, and I should say that Kent Kestner brilliantly summarized a lot of the points, highlighting the concepts of coordination, the multidisciplinary role of One Health, capacity to execute ideas, innovation, and leadership. And it's at that leadership level that I think that we're going to be discussing really today in terms of how to build a workforce that and build both up and down leadership up towards the levels of policy and government, as well as down into early levels of education. And so that's what we'll be discussing in part today. And what we're going to have is a first session, which will be 2 panels, and then a second session, which will be 2 plenaries.